Hello everyone, welcome to our YouTube channel for nurses preparation. I am Neeraj Kumar Kathal. I Norcet exam 2021. For this exam, we are regularly uploading important topics videos. Today we are going to discuss about ECG, electrocardiography. Let's begin our today's video. ECG's full form is electrocardiography. Point number 1. ECG is a non-invasive diagnostic test. ECG, electrocardiography, is a non-invasive diagnostic test. Non-invasive means a procedure in which apparatus are not gonna insert into the body. This called non-invasive. Invasive procedures are the procedures in which we are administering any equipment in the body. So ECG is a non-invasive procedure. We are just attaching electrodes to the person's chest and record electric activity of the heart. So it is a non-invasive diagnostic test. Point number 2. To evaluate heart function by recording electrical activity of the heart. By ECG, we can evaluate the functions of heart by recording electrical activity. In ECG, we are tracing or recording the electrical impulses or current or activity produced or done by the heart, and by this electrical activity we assume or just think what is the real condition of heart. If there is abnormal electrical activity shown in ECG strip, we can say there is some kind of problem or some kind of disease present in the heart. Next point, by ECG we can evaluate important cardiac dysarrhythmias, location and extent of myocardial infarction, etc. For the evaluation of person's heart, we are performing ECG. By ECG, we can detect any kind of dysarrhythmias, in heart or heart attack or myocardial infarction. Is there heart attack is present or not? If the heart attack is present, how much damage was there? We can evaluate with ECG. Next point, during procedure, advise client to do not talk, breathe normally, lie still. Now let's talk about the normal ECG. How normal ECG looks like. You can see in the diagram, if a person's ECG strip is having such type of electrical activity recorded, you can say the person's heart condition is good. In ECG, first P wave, then QRS complex, then T wave and U wave. The space between P and R known as PR interval, and this space between P and R known as PR segment. P and R, PR segment, P and R, PR interval. This is QRS, QRS complex. Space between S and T, ST segment. So you can draw this diagram for your revision. This is a normal pattern of ECG. Now let's talk about some important points about ECG. By ECG we can record electrical activity of cardiac cells at a speed of 25 mm per second. If examiner asks how much speed we can record electrical activity of heart by the ECG, you have to give the answer 25 mm per second, or we can simply say 2.5 centimeters per second. 25 mm per second or 2.5 centimeter per second. Next point is, in ECG paper or ECG strip, horizontal lines denote time in second. In ECG paper, horizontal lines represent time in second, where vertical lines represents voltage. Vertical lines represent voltage. To remember this, vertical lines V represent voltage V. V and V. Next point. In ECG, small square 0.04 second. It is a very important. It was asked in previous exams. Each large square of ECG 0.20 seconds. Important. In ECG, P wave represents atrial depolarization. In ECG strip, this P wave represents or formed when the upper chamber of heart atria depolarization. Remember an interesting thing, depolarization means contraction of heart. When heart contracts, it's known as depolarization, and repolarization means when heart relaxes. So when the atrial or upper two chambers of heart contract, this is represented in ECG by the P wave. Next, normal PR interval 0.12 to zero point 0.2 seconds. This is a PR interval. Its duration 0.12 to 0.2 seconds. QRX complex. This QRS complex. This QRX complex represents ventricular depolarization. Hearts below two chambers known as ventricles or ventria, if they depolarize or contract, this represented in ECG by the QRS complex. Its normal duration 0.01 to 0.1 second. Next point. ST segment shows early ventricular repolarization. ST segment. This is the ST segment, and it represent early ventricular repolarization. Next point, prominent U wave shows hypokalemia condition. Important. If a person is having hypokalemia condition, hypokalemia means decreased potassium level in person's body. If he having hypokalemia, in this time ECG wave U wave become prominent. This U wave become prominent in case of hypokalemia. You can take a screenshot for your revision purpose. Now let's talk about an important condition from which mostly examiner ask question in exams. The condition is related with electrolyte imbalance and especially potassium's disturbance. Here the normal ECG is presented, and in our body normal potassium or K plus level is 3.5 to 5.0 MEq per L or milli equivalent per liter. If a potassium level falls below 3.5 MEq per L, this condition is known as hypokalemia. And if the person's potassium level more than 5.0 MEq per L, this condition is known as hyperkalemia. If a person who is having hypokalemia condition, we observe ECG, the ECG will show ST depression. This is the ST segment. ST segment depression. In normal ECG it is flat, but in case of hypokalemia ST segment become depressed. Next, shallow flat or inverted T wave. In normal ECG, this is the T wave, but in case of hypokalemia, this wave will be flat, shallow or inverted. Inverted. Next, prominent U wave. In normal person's ECG, generally U wave is not visible. If in case U wave is present and it is prominent, it means person is having hypokalemia condition. Always remember, potassium is a very important electrolyte for the person's heart, and it is very dangerous also. Next is ECG changes in person with hyperkalemia. In hyperkalemia, ECG shows tall peaked T wave. This is the normal T wave, but it becomes tall peaked T wave. Tall peaked T wave shows hyperkalemia. Flat P wave. Flat, this is a normal P wave, this will become flat. Flat P wave. And widened QRS complex. This QRS complex become widened. Widened QRS complex. And prolonged PR interval. This is the PR interval and it will become prolonged. Prolonged PR interval. So, if a person's ECG report shows tall peaked T wave, flat P wave, widened QRX complex or prolonged PR interval, you can say this person is having hyperkalemia. Normal potassium level 3.5 to 5 milliequivalent per liter. You can take a screenshot for your revision. Now let's talk about another point where examiner can ask directly question from the topic is myocardial infarction. This is the normal ECG pattern, and in case of myocardial infarction or heart attack, person may have two types of ECG changes in this ST segment. First type is ST segment elevation MI. In short, it is known as STEM MI. ST segment elevation. If there is ST segment elevation, this wave seems like this. This wave elevated. ST segment elevated. And if there is a non-ST elevation MI, in short, it is known as N-STEMI. In this case, the person ECG shows normal ST segment. Next important ECG change in heart attack is T wave inversion. This is the normal T wave, and in case of heart attack or MI, this will become inverted. This T wave seems like this in case of MI. T wave become inverted. Next, abnormal Q wave. This Q wave is normal. This Q wave is normal, but in case Q wave become abnormal. This is the star point of this MI ECG changes. Next point, hours to days after MI, ST and T wave changes return to normal, but Q wave changes remain permanent. Most important point, if a person is having myocardial infarction and after few days you take a ECG again, in this ECG you can find the ST and T wave normal. ST and T wave normal because as the time passes, heart's condition resolves. But in case of Q wave, it remains permanently abnormal for whole life. After getting MI, a person's Q wave never gonna come normal in ECG. So everyone, this was all important regarding the I Norcet exam 2021 from ECG portion. You can take a screenshot for your revision purpose. Thank you so much friends. If you think this video is helpful, then please click upon the like button, share this video with your friends and subscribe our YouTube channel for more such interesting videos. All the best.